we're gonna let the federal government and a bureaucrat decide who you take your child to when he or she is sick at 11 o'clock at night, who your pediatrician's going to be. That ain't the answer either. So if Democrats are sitting around scratching their head going, wait, why are we doing so poorly against this guy when his economy is weaker than Jimmy Carter's?
So what you just heard there was Morning Joe Scarborough earlier today on MSNBC News, talking to Anthony Scaramucci, of all people, about the supposed dangers of Medicare for all, of a single-payer healthcare system. And he argued that Donald Trump is ripe to be defeated, but that a single-payer system will help re-elect Trump because it takes away freedom from regular Americans regarding their own healthcare and the healthcare of children, and that regular Americans will be afraid of that, and they will go to Trump out of fear of a Bernie Sanders-style healthcare plan. But I want to suggest that Joe Scarborough is basically 100% wrong here, and that the problems he associates with single payer actually don't apply to single payer, but rather to the private-based insurance model that currently exists in the United States. And Scarborough is part of this movement, which includes Joe Biden and Pete Buttigieg, that upholds the mythology of choice, which is that the American model is great and it works because people have choice. But for most people, even if they have insurance or even if they don't, the ability to choose their healthcare is strictly limited. If you don't have insurance and you can't afford to pay for care, you don't get a choice at all. If you need to see a doctor, if you need medicine, if you need dental work, you don't get to choose, you just go without. So for millions of people, there is no choice. But even if you're lucky enough to have insurance, maybe you can't afford deductibles and copays and other ancillary costs that hit you when you need care. And so that when you actually are sick or do need medicine, you have to weigh the benefits. Is it worth the deductible and copay or potential increase in rates for me to get the actual care I need? Or should I just quote unquote tough this one out? And even if your procedure is fully covered, and even if all the ancillary costs aren't an issue, your particular insurance company still gets to determine what services you can and cannot get. And it still gets to determine which doctors and which healthcare facilities you can and cannot use. And so you might think you're fully covered. You might think there's no deductible or copay issues, but what if your claim is denied? What if they force you to go to a particular doctor or set of doctors that you don't really like? Or what if a doctor that you're accustomed to isn't part of the network, quote unquote? In all of those instances, your choice is being restricted by bureaucrats, but not public servants that are ultimately accountable to the people, but private bureaucrats accountable to private capital and to shareholders who are in no way democratically elected or chosen by the American people, nor the representatives of those American people. So in essence, the choice model, the choice mythology of the private system is extremely limited for the vast majority of people. But a single-payer system in most ways gives more choice. And I want to speak from my perspective as a citizen of Canada. In Canada, we have a hybrid model. A lot of people assume that our single-payer universal healthcare covers all essential healthcare, but it doesn't. It covers things like surgeries, and if you have to stay in the hospital, and if you have to visit your general practitioner, or if you need emergency care, but it doesn't cover medicine and your teeth and many other things. And so I can say that when it comes to the things that are covered by single payer, you have a ton of choice. But when they're not covered, you start to see the flaws of the choice mythology rooted in the private system. And so let's use an example. Joe Scarborough says you have a sick child, you have a child that's ill, and government bureaucrats under a single-payer system will supposedly control how you care for your child. But that's not true. Here in Canada, if my child is sick, I can take them to any doctor using my Ontario health card, my government-issued health card. I can take them to their family doctor. I can take them to an emergency clinic at a hospital. I can take them to a more routine clinic. I can take them to an after hours clinic. It doesn't have to be in my hometown. It doesn't have to be a doctor I've seen before. I can go in any of those instances, either a walk-in or by appointment, to see a doctor. They only need to see his health card. That's all. That's all they need to have, because that's the system they use to bill the single payer network. The doctor will get paid, the system will keep running, and I won't have to pay any money either then or later for that particular procedure. That is the pinnacle of choice. Sure, the Canadian model isn't perfect. Sometimes there are wait times, but there are wait times in American hospitals and clinics as well, especially for lower and middle income people. But the system gives me choice. I am never rooted to one particular doctor, never rooted to a network, never rooted to a particular hospital. Now let's compare that to the private elements of Canada's healthcare system. Say I take my son to the doctor, and the doctor says that he needs a particular medication to get better. Now, that means that I have to go to the pharmacy to get the prescription filled. Prescriptions are not covered under Canadian healthcare in most instances. And so you have to start doing all of those calculations and bureaucratic moves in your head. Is this particular medication something I can afford? Does my private insurance model cover it? My wife has private insurance through her workplace, and I'm on her family plan. If I have insurance, how much of it is covered? Is it 100%? Is it 90%? Is it 80%? Will my insurance cover this particular medication? Is there a chance that they want me to use a specific pharmacy or not use a specific pharmacy? All of these things have to be considered. Is it the sort of medication where I have to go out of pocket and might have to wait weeks and weeks and weeks to actually get my money back? Meaning that if it's a very expensive prescription, I might have to go into debt on a credit card and incur interest and do all those sorts of things just to get my son the care he needs then and now. And that's medicine. Now, there are certain programs that exist in certain provinces that help cover children or seniors, but they're all patchwork. They're not consistent. It's not always clear what is and isn't covered and who is and who isn't covered. And so comparing that to the single payer system, where you can take your kid to the doctor and you'll know that you won't face a bill when it comes to getting them the medicine they need to get better, it's a whole different ballgame for you, for them, for millions of Canadians. And the same thing with your dental care. You can go to the doctor with a severe dental issue. They might give you some medicine. They might tell you that you need to go see a dentist. That first visit's covered to go see your doctor. But dental work and dental surgeries, for the most part, are not covered in Canada. Meaning that if you have dental issues, you have to either go without, pay out of pocket, or hope your insurance covers it. Hope your insurance doesn't have crazy copays and deductibles. Hope your insurance doesn't put you out of pocket for weeks and weeks and weeks when you can't afford it. Hope that your insurance doesn't say something's covered and then, change their mind afterwards, forcing you to fight for the money that you're owed. That's the Canadian model when it comes to teeth and the medicine you need. And so what all of that is doing is removing choice, removing freedom, removing certainty. And so if you're an American and you want to compare the two systems, look to my example. When you go to the doctor, when you get that basic healthcare you need, you can go with a little rectangle plastic card. That's all you need. You can go see any doctor. They'll see you. They'll get paid. Don't worry about it. They'll get paid. They'll bill the government. That's how it works. And then when you need to get dental work, or you need your medication, that's when the private models comes in. That's where the choice exists, because you could choose a different insurance model. You could go with a different company. You could buy a fancier or a less fancy plan. But at the end of the day, all of that is fundamentally limiting you, because the single payer model, if applied to dental work and to medicine, would actually cover all of those things. You would just know, I have a doctor prescription. I need to bring that to the pharmacy. I will get my medicine. They will swipe my card or copy down the number on my card, and I will go home with my sick child to give them the medication they need. Or I have a cavity, or I need a crown, or I need some other kind of essential dental work, and I don't have to worry about particular dentists not accepting my insurance. Every dentist will cover me because it's under the single payer model. So to close, I just want to fundamentally underline that the single payer universal healthcare Medicare for all system will offer far more choice to far more regular people and far more certainty to far more regular people. And that the choice that supposedly exists when it comes to private insurance is not really choice for you. It's choice for your insurance company about how much they're going to cover you, if they're going to accept your claim, which doctors you can go to, which hospitals you can visit, and on and on and on and on. That's not choice for you. That's choice for the social and political and economic elite. If you want a model that allows you to make the best decisions for your own health and for the health of your children, a universal single-payer healthcare model is the way to go. Don't listen to Joe Scarborough's fear-mongering. Don't listen to his projection. Understand that when it comes to choice, the private profit-based model gives regular Americans almost none of it.